Good day, everyone. I'm Pooja Joshi, your host for today's episode. In this session, we focus on a condition that is common yet often misunderstood: irritable bowel syndrome, or IBS. To help us navigate this important topic, we are joined by Dr. Naveen Polavarapu, MRCP, FRCP, and CCT from UK, and practicing as a gastroenterologist at Yashoda Hospital, Hyderabad, a respected expert in functional gastrointestinal disorders. Today, Doctor will walk us through early symptom recognition, simplified diagnostic approaches, and effective evidence-based management strategies for IBS in routine clinical practice. Doctor, thank you for being with us. Let's begin our discussion.
Hi, I am Dr. Naveen Polavarapu. I'm a clinical director in gastroenterology and liver services at Yashoda Hospital's High-Tech City, Hyderabad.
So, doctor, question for you is, why do you think IBS remains one of the most underdiagnosed gut conditions in India?
Yeah, so in fact, not just in India, irritable bowel syndrome is one of the most common conditions that a gastroenterologist sees, and throughout the world, in fact, and it is underdiagnosed, undertreated because a lot of patients do not know what irritable bowel is and how to actually approach and how to actually understand the symptoms in a way that they can actually express to the patient, to the doctor. So that's the reason why IBS is a very common condition, yet treated, underdiagnosed condition throughout the world, not just India, throughout the world.
In your experience, how does a typical IBS patient present in an OPD?
So a typical irritable bowel syndrome, or IBS, IBS is different to another condition called inflammatory bowel disease, which again is IBD in short form. IBS, short form is IBS. So people get confused between IBS and IBD. IBS is a functional disease. IBD is an inflammatory disease. So both are different. Now, coming to the irritable bowel syndrome, often patients come to our clinic with abdominal bloating. So tummy gets bloated. Sometimes they have discomfort, spasms. Sometimes they can also have diarrhea. Some people may even actually have constipation. Typically, it is triggered by eating certain type of food, which triggers the symptoms. And most often it is a diet and the stress which trigger these symptoms and causes the flare-ups of this irritable bowel syndrome. So the common symptoms are bloating, discomfort, and also passing stools like a diarrhea, loose stools or having a constipation. These are the common symptoms people present with.
What are the biggest myths or misconceptions you hear from patients about IBS?
I think biggest myth I would say with IBS is this disease going to progress? Does it lead to anything serious like cancer? This is the biggest myth that people commonly present with. I think as a doctor, if we do answer that question saying that irritable bowel is a non-progressive condition and it will definitely not lead to any serious problems like cancer, most of the patients get reassured and they feel comfortable, and that is in fact the most important treatment for irritable bowel as well, is counseling the patient to say that it is not a harmful disease.
Is IBS really a stress disease, or is there more to the story?
Yes, absolutely. Irritable bowel syndrome is very much linked to the stress and anxiety, and the typical example that I give to the patients in my clinic with irritable bowel is people who actually go for example, the interviews. Their tummy rumbles, they have to visit loo quite often, and that is, if they're eating, they must be eating the same food even before and after as well, but yet they're having problems during that kind of interview period or the assignment period, and that's because of the stress. Okay, the intestine, for it to mobilize, for it to move or to function, you need a lot of receptors like chemical, mechanical, nerve receptors. Some of the receptors even come from the brain as well, which control the movement of the intestine. And whenever you are stressed, obviously this pathways gets activated quite significantly, and that's what causes people to have more of this irritable bowel syndrome. So yes, stress and anxiety definitely triggers irritable bowel syndrome, and that is one of the most important treatments, is to how to reduce the stress and anxiety, which will help in controlling the disease.
What simple screening questions can a consulting physician ask to suspect IBS?
Yeah, so very important question. I think irritable bowel syndrome, as I said, is a functional disease. In other words, it's a diagnosis of exclusion, which means you exclude all the serious conditions before you label somebody as having irritable bowel syndrome. So rather than asking the screening questions about what are the symptoms of irritable bowel, what symptoms we should be asking as a physicians are, what are the alarming symptoms which would say that this is not irritable bowel syndrome. For example, somebody is having bleeding through the motion, or if they're having incomplete bowel evacuation, or they feel like there is something stuck in the rectum that they're not able to empty properly, or somebody is having unexplained weight loss. So, or if they're having anemia, iron deficiency anemia particularly. So any of these symptoms like unexplained weight loss or bleeding through the motion or change in bowel habit, like somebody who is having normal stools, now they become constipated, or diarrhea, somebody who's actually goes to the stool 2 or 3 times a day, that is normal for them, but now they're passing once daily. That's a change in bowel habit. So any change in bowel habit, if it persists for more than a couple of weeks, particularly if the patient is above 45 years, then they should definitely be seen by a gastroenterologist, because these could be signs of something alarming like inflammatory bowel disease, or more worrying like the cancers. So colon cancers or intestinal cancer. So any of these symptoms we should definitely not ignore. So I'll just repeat it again because this is a very important point. Anybody who's having bleeding through the motion, or change in bowel habit, or unexplained weight loss, or abdominal pain, particularly if all these symptoms are lasting for more than 2 to 3 weeks in a patient who is above 45 years, they definitely need to be investigated.
Are there any warning signs where a physician should immediately refer to a gastroenterologist?
As I said, anybody who's having unexplained weight loss, PR bleed or blood in the stools, or any change in bowel habit and having abdominal pain, any of these symptoms lasting for more than a week to 2 weeks, they should be seen by a gastroenterologist. That's the time when they should be referred.
How often do you see IBS overlapping with anxiety or depression, and how do you address it?
Yeah, my very important question. I think we already covered this topic earlier. Yes, irritable bowel syndrome and anxiety and depression, they go hand in hand. Very much interlinked, overlapping is there. So again, the treatment for irritable bowel syndrome in these patients is to control the anxiety and depression. Once you control the anxiety and depression, your irritable bowel syndrome also improves. So it's very important that we tackle the root cause of the irritable bowel syndrome. And the root cause, most often it is the anxiety or stress, or sometimes it is the type of the diet that we eat. So if you control all these symptoms, then you should get better. So that's what we should concentrate on as a gastroenterologist. That's what we should be treating for.
What are some practical ways physicians can build patient trust in IBS treatment?
Practical tips, again, as I said, is I think first important thing is we as physicians should understand the patient and spend time with the patient, explaining to them, giving them a patient listening ear, that we have actually spent time with the patient, counseling them in detail about that. Look, this is a non-progressive, not a serious condition. You will have good days and bad days with this disease, and making sure that they get reassured that this disease will not lead to anything serious like a cancer, and also making the patients understand what are the triggers for these symptoms, because unless you remove the root cause or the triggers, these symptoms will come back again and again. That's why it's important as physicians that we educate our patients about what is irritable bowel syndrome, and how do we and why do we get irritable bowel syndrome, and how to tackle this, and what steps we need to take to tackle these symptoms. So I think most of the treatment lies in educating and counseling the patient about the trigger factors and also controlling the symptoms.
How can physicians and gastroenterologists collaborate better for early IBS diagnosis?
I mean, to be honest, if you ask me, IBS can also be and should be managed by the physicians as well. The patient doesn't have to come to a gastroenterologist or a specialist for this. But I think it's important that the physicians understand the alarming symptoms. We already discussed about these alarming symptoms before, but I think once we know that there are no alarming symptoms, we can give a trial with medications, and not just the medication, counseling the patient and helping out with the symptoms. But the physician should be very clear in terms of what are the alarming symptoms or the signs that they should not ignore, and they should send the patient to the gastroenterologist. So it's a two-way phenomenon. Gastroenterologists should be able to pick up those things and then take care of them. And once we see a patient saying that confirmed it's irritable bowel syndrome, these patients can also be managed and should be managed by, as I said, by the physicians as well.
One myth you'd like to bust about IBS.
Yeah, so as I've been telling earlier, IBS is non-cancerous condition. It will not lead to cancer or anything serious. It will not progress to anything serious. So that's the very important myth that we as a gastroenterologist should break that in the patient's mind, because unless they get that reassurance that this is not a progressive condition, this will not lead to anything serious, they will keep getting worried about this disease, and this disease will not settle or will not go away without having that reassurance. So I think it's very important that all our physicians should break that myth that this will not lead to cancer, this will not lead to any serious problems. I think that's a very important myth that we all should break it.
One word that describes a typical IBS patient journey.
Okay, so typical journey of irritable bowel syndrome, they will have good days and bad days with it. They will have days when they feel much better, the symptoms are better. The symptoms, when I talk about the bloating, constipation, diarrhea, discomfort, all these abdominal discomfort, all these symptoms, they'll have good days and bad days with it. Now, if they actually dig deep enough into those, into the days, why they're having good days, why they're having bad days, what do they do to have a good day, what do they do to have a bad day, what diet did I have to have a bad day. So if they actually analyze that in detail, they'll understand the journey. The more they understand about themselves, about their journey, the better they'll be able to control the disease. So it's all about patient education. Understanding and knowing about themselves is very, very important. So hope I was able to answer most of the general questions that people have. So I'm Dr. Naveen Polavarapu. I'm a clinical director in gastroenterology and liver services, and thank you for listening. And if you do have any questions, please do approach us. We're happy to help you out. Thank you.
Thank you, Doctor, for sharing such valuable insights on IBS. Your clarity and practical guidance will certainly help both physicians and patients approach this condition with more confidence. To our listeners, thank you for joining us. Stay tuned for more expert-led conversations. Until then, take care and prioritize your gut health.